Good afternoon. Today's date is 3rd of November 2024 and today is Sunday. I am Professor Dr. I.B. Raju, surgeon, myself, a Dean PGs of a medical college and superintendent of a teaching hospital. Today I want to discuss how to protect liver, okay? Liver. We have liver, okay? We have to protect it. Right? Yes. If you don't protect it, you can get, fatty liver. This can lead to again hepatitis. It can lead to cirrhosis. It can lead to cancer and all these problems. So, who will develop liver problems? Who will develop? Who are the people with risk to develop liver problems? Means who should actually more concerned about the liver and to protect the liver. Okay? The first and most important is diabetes patients. Diabetes patients will get fatty liver and the problem starts there. Hypertension patients, BP patients will have fatty liver. Who? Diabetic first, second is hypertension patients, BP patients. Third is obese patients. Obese patients will have liver problems. Next is inactive people. Inactive people. People who don't do exercise. They will develop fat in the liver. Okay? And also people having more triglycerides. People having more LDL in the blood. They will develop liver problems. Okay? So all these patients are a potential risk of developing fatty liver. And another most important group of people who develop fatty liver are people who take alcohol, excess alcohol. They will develop, fatty liver. So I told you the risk people include, who are the risk people? Who are diabetic, who are hypertensive, who has more triglycerides, who has got more LDL in the blood, okay, who are obese, who are not active people, and who take excess alcohol, the liver could get damaged. Fat accumulation in the liver, which could give to hepatitis, which can give to cirrhosis, which can cause cancer, and all these problems. So how do you detect the problems? Do you know your liver is good? Go for liver function tests. Just give the sample of blood. They'll tell you how your liver is. If your liver is enlarged, go for ultrasound of the liver. If the liver is not enlarged, generally common investigation, liver function tests. Please do liver function tests once in 6 months above the age of 30 years. Especially, everybody should get the liver function test. Especially those who are having the above risk factor which I already told you. Okay? So now the point comes is how to save your liver. First is take vaccination for hepatitis B. Take vaccination. Point number 1. Point number 2 is control your diabetes. Point number 3 is control your BP. Next point is reduce your obesity. Next point is be active. Okay. stop drinking or reduce drinking. The most important factor is exercise. Okay? Every person above the age of 30 years should do minimum exercise of 2.5 hours a week. 2.5 hours a week. 150 minutes a week you should do. Okay? There are two types of exercises, isometric and isotonic. Okay? The ideal is you go for brisk walk, not just walking, fast walking. Bit. Okay? Brisk walking is a wonderful thing. Or go for cycling, or go for swimming. Okay? So, half an hour a day for at least 5 days in a week, if you do exercise, the fatty liver becomes normal liver. Yes. You understood? Another important point is, first I told you exercise. If you do exercise, automatically the weight reduces. Your diabetes will be under control, your BP could be under control, and all these things. Second, another important point is the diet. Okay? Very, very important. And diet plays an important role in causing this fatty liver. Okay? Diet. Don't touch sugar. Reduce sugar. If you can't avoid, at least reduce sugar. Yes. I've seen lot of people taking, fast foods. Fast foods also are very deadly. Don't touch fast foods. You understood? Take for example potato. Potato could be 3 rupees or 4 rupees in the market. They make chips, keep in the plastic, stored. There are instances when these chips can be stored up to 1 year. So 4 rupees potato will cost 100 rupees chips. So lobbying, big factories. You understood, no? We can't ask them to stop. We should control. You understood? Don't touch all these fast food burgers. Oh my God. Very dangerous. All stored food. You understood? And also sugars, cool drinks. Oh my God. Cool drinks are as bad as alcohol. Perhaps more worse than alcohol is cool drinks. They give spike of sugar levels. Yes. And also I have seen people taking juices, fruit juices. No fruit juice. Fruit juice is very, very bad. Yes. You know how the juices started? The juices started in the United States. You know what happened? Decades back, centuries back, they have cultivated a lot of oranges in the United States. The shelf life of orange, they get spoiled. They used to export to the other countries. If it is delayed, what used to happen is they used to get rotten. So they got a good idea. Industrialists got a good idea. Let us prepare juice from orange. Keep some preservative. You can keep it for 6 months. You can keep it for 1 year. Okay? This is how the industry is. Never take fruit juice. Yes. Never take fruit juice. Eat fruit. It's good for health. You understood? And cool drinks, oh my God. Very deadly, very dangerous, very high calories. Lot of sugar. The sugar will definitely turn into this fat and sit in the liver. Okay? Never touch cool drinks. Never touch cakes. No. If you want to be healthy, if you want to live for 100 years active life, don't touch all these things. Okay? Be healthy. Take fresh food. If you want to have a cake, If you want to have anything, suppose you want to have fruits, nice. It's nice to have fruits, okay? So now I will tell you some of the diets. I told you to do exercise. I told you not to take, this fries and all those things and no juices. Even cooking oil is also very important. You use extra virgin olive oil or avocado oil for cooking in the house. In some houses, they prepare fries, vegetable fries. Okay, if you use extra virgin olive oil, because ordinary olive oil will have smoking point at 150, 165 degrees. But extra virgin olive oil has got smoking point of 250. You can fry. Not a problem with extra virgin olive oil or avocado oil. The smoking point of avocado oil is 250 degrees. And it is one of the best oils where saturated fats are very less. Monosaturated or polyunsaturated fats are more. Fatty acids are more. They will reduce the LDL, they will reduce the triglycerides, they will increase the HDL, and all those problems. All the problems can be avoided if you use extra virgin olive oil, avocado oil. They will clean the arteries. Nice. So good. They got also antioxidants, they got omega fatty acids, and all those things. Not a problem. It's good for liver. Okay? Next you may ask me, say, what fruits are good for liver? Good for liver are avocado fruits. Good for liver are pears. Eat more pears. Good for liver are blueberries. You can eat. They don't have glycemic index. They have got very low glycemic index and very good for liver. Take garlic. Garlic is excellent. Keep more garlic in the curries. The liver will become excellent. It will get rid of fat. Garlic. Okay? And if you want to clean the liver, you can also take green tea. Yes. Green tea without milk will clean the liver. Okay? Also take beetroot. Also can take carrot for cleaning the liver. Okay? I told you some of the fruits. You use more garlic. You use more green tea. And vegetables, green leafy vegetables are excellent. Beetroot occasionally, carrot occasionally will clean the liver. Okay? You can see your liver. People, I recommend liver function test for all the people above 30 years. Even if you don't have any problems, you just get once liver function test. However, the risk people, or I already told you, who are obese, they are at risk. Who are less active, they are at risk. Who are diabetic, they are at risk. Who are hypertensive, they are at risk. Who has got more triglycerides and LDL in their blood, they are at risk. So, all of you should get frequently liver function tests. If they are normal, it is fine. If they are abnormal, you should be very careful. And also research has shown that people who sleep better, more hours, will not have fat in the liver. Yes. Because in the sleep you are fasting and the probability of having liver fat is less. Sleep well, no tensions. Okay, eat properly, exercise better, keep thin, you will not have fatty liver. Have a wonderful health, have an excellent liver, because liver is one of the important organs Till the age 100 years, you should live a happy life. And the liver should be very, very healthy without fat. Have a wonderful day. Bye.